The healthcare system in St. Lucia is made up of a varied network of systems, institutions, and programs, both within the public sector and also the private sector. And this is brought through our hospitals, of which we have two statutory hospitals, the St. Jude Hospital and the Millennium Heights Medical Complex, together with the Tapia Hospital, which is our private facility. Within the primary care, we have a range of health facilities ranging from level 1 to level 4. Our level 4 facilities are our district or community hospitals and polyclinics, and our lower level facilities within the community. And these services, together with a wide range of private providers, from medical services to diagnostics as well within the country, are many services which we can't manage within St. Lucia. We also have relationships with external agencies for transfer. The St. Jude Hospital, which is located in the south, is an extremely important component of our health system. Keeping with the government's main national priority for health, that is universal health coverage, and also our National Strategic Plan for Health for 2025 to 2035, which both of them speak to ensuring accessible, affordable, and quality health care to the population. St. Jude Hospital, which is located in the south, provides secondary care services. One of the very important pillars in relation to providing universal health coverage is health equity. So the commissioning of St. Jude to the refurbished site will ensure that the residents in the south have access to quality of care within a facility that can provide the care at the standard that we need to provide it at. And it is important within the island for the population that we serve that we ensure that both of our health facilities are able to provide health care at a specific standard. That is the secondary care services such as surgery, delivery, dialysis, the capacity to manage emergencies. And St. Jude is located in the south, where our international airport is located. So it is also important that access to care, if there are any emergencies related to international travel, we are able to manage it. So we are working very closely with the committee at St. Jude to ensure that the services that will be provided meet the standard of care, so that there is equity within the north and the south. We do expect the full commissioning of the hospital to support both our National Strategic Plan and the government's priority for universal health coverage. We have generally two levels of care within St. Lucia, and one of the areas that's important for universal health coverage is sustainable health financing and also reform. So apart from us providing quality health services, we have to ensure that it's done in an effective, efficient, cost-effective way, because we have to ensure sustainable financing to manage health care. Secondary health care services are much more expensive in their provision as compared to primary care services. One of the priorities for the ministry, and this falls under my office, we have been doing the necessary assessments of our district hospitals, for example, and our polyclinics. We are working on the expansion for expanded hours and also expanded services to include diagnostic services. And this will definitely support the improvement in services at the hospitals. One of the issues which we have been managing over the last few years are lots of complaints coming out of the emergency rooms at the hospitals. And part of it has to do with the limitations within care, within primary care, especially when it comes to diagnostics, and the limitations in our opening hours. If we are to extend our hours within key primary care facilities and also the services, we would be able to better manage the needs of the populations. So when we look at areas such as the Grosley Polyclinic, the Betty Wells, Dennery Soufre, and the Viewfort Wellness Centers, if we can increase the services that are provided and also the times, our patients will be able to access care closer to their communities, and it will reduce some of the complaints and the poor outcomes we get when patients wait extended hours within the hospitals. What will it mean for the two hospitals? They will now be able to concentrate their services on secondary care. So they would now be able to manage emergencies, deliveries, surgical procedures, the more complex hospital-based services, and we should get improved outcomes given an improved patient satisfaction. So it will improve quite a few of the pillars towards universal healthcare. That is, there will be better access, since you could access those services closer to your home. It will also be more affordable, because most of the services within our primary care are either free of charge or a lot more affordable, and it will be more economical for the government as well, since the provision of those services within primary care is at a lower cost as well. And quality of care would be improved, as there would be reduced waiting times, and we would be better able to manage the lower level services within primary care as well. The commissioning of St. Jude would be extremely important. It's also very timely to support universal health coverage. It will allow us to manage our patients a lot better, strengthening the referral systems from primary care to secondary care. And I think we've been managing, and I really have to commend the staff at the St. Jude Hospital. There is a very warm culture that exists within the South and the St. Jude Hospital. I really have to commend the staff for all of what they have been able to manage over the last few years within the stadium. So I think us reopening the St. Jude, the level of motivation, satisfaction, and the level of the providers giving care would also boost the quality of care that we are providing there. When the St. Jude Hospital is fully commissioned, it would mean services would be provided in a safe environment that is actually set out for hospital care. So the spaces are a lot bigger. The equipment would be new and updated equipment. The processes as well are being updated. The clinical protocols are also updated. And we are looking to widen the services that are provided at the St. Jude Hospital.